Dear doctors and friends, I welcome you all to this final edition of the ELBS Orthoplasty Fellowship. And we had an exciting journey over the last few weeks. Really, we started with the basics of knee replacement surgery and went on to describe what are the new alignment philosophies, and we went on to knee replacement for life, which is quite possible now in 2026. We also started with basics fundamentals of hip replacement surgery, and we also discussed the possibility of a hip replacement for life, as Prof. Hart strongly believes in. And to achieve both knee replacement for life and hip replacement for life, the basics in joint replacement surgery, the basics in orthopedics is more important. The quality is more important than just numbers, and that's what we sort of driven into our trainees, really. And week three, we went into advances in knee replacement surgery. We discussed about the humanoid robotics, where AI is coming in a big way, where we are taking knee replacement to the next level, where we can give solutions which are not been found in the last several decades in the world. And last week, last but not the least, we went into complex hip replacement surgery, which is only possible by an expert trauma surgeon trained to the best level in the world, and an expert joint replacement surgeon trained to the best level in the world. So only he could deal with the complexity in a hip replacement surgery, where you are taken step by step how to do a hip replacement in acute acetabular fracture, which needs you to be the best trauma surgeon in the world. Trauma, we all know, is bread and butter. All of us are trauma surgeons on earth, and the best joint replacement surgery surgeon as well, where you're trained to understand the principles. And again, if you don't understand the fundamentals, then you can't get things done properly. That's the whole point of this, really. So okay, and now this is the last episode. We are going to go into what is called as an entrepreneurship thing, because we find that India is at a crossroads. And we expect that by 2030, many of the doctors will be jobless. Why it's going to happen that they'll be jobless? Because if you look at states like Tamil Nadu and Kerala, already there are too many doctors being produced. There are not enough jobs. And this trend is going to continue because there is no thought leadership in this country. People are just blindly after money, numbers, 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 and nobody is after quality, and that is the problem. And if you just look at, I just got a message from one of the senior medical legal leaders that now to get the postgraduate seat, you need to get minus 40% marks, something like that. You should be minus 5 percentile to get a mark. That means you could be a dud, but still you will become a MS orthopedics or an MD radiology or MD medicine in this country, because there are no PG seats being filled, and a lot of doctors don't want to become postgraduates. Okay, and I understand NMC normally takes a week to approve this, but I believe all the stakeholders in this situation approved it in a lightning speed of 24 hours. That means you can be dud, you can be having 5% percentile marks, or even minus 15, 20 percentile marks, but still you could be a doctor in this country, you could be a postgraduate in this country, and you could really play with the lives of people in this country. And everybody is looking away, because these colleges, who are really pushing for increased numbers, private seats, MBBS 1 crore, and private medical colleges, PG 5 crores, they just want numbers, a number-driven thing. And sadly, the regulators and the stakeholders involved, including the judiciary, is looking away, not doing their duty really to the public. And as a result of that, the more number of doctors will produce, with no faculty in those colleges, and ghost faculties, and no patients, and there's no training. They just spend 1 crore or 5 crore. And I was told by one of the regulators recently that I believe these people are not even interested, because they've put 5 crores to come. Who will be interested if they've got 5 crores? You need a hunger in the belly. You need a poor student who really want to serve people to come into MBBS. Then he's going to really be the difference. He's going to make a difference to people's life. Somebody with 5 crores in their bank, rather invest in bank and earn money, rather than come to medicine, just for fashion's sake. So I think future is going to be bleak in India for juniors, and hence this talk is very, very important. Last but not the least, as they say. And so let's go on to look at how we can build your own hospitals and your own enterprise as a doctor. This is the real meaning of what they call as a Atmanirbhar Bharat, because essentially nobody is going to really help you in this country, you need to be on your own and do your own things. That is the real meaning of Atmanirbhar Bharat. Just give me a second. Let me share my screen, and then we'll go straight to this very, very important presentation for today. How to create an Atmanirbhar Bharat. Right. So let's start from the beginning. The creation of an Atmanirbhar Bharat and how to go about it. Okay. So healthcare entrepreneurship.
So I see a lot of new faces, so it's my duty to introduce myself. I'm Dr. Srikanth. Here I trained in UK in all aspects of operations and pharma. I have been interested in courses like robotic surgery and patient-specific implants. I did a fellowship which is recognized by German Medical Council in promoting the hospitals doing close to 400 navigation surgeries. And I also have a specialist interest in kidney, sports and revision surgery. I did a fellowship in Avon Outreach Center, and also for Acharya there in Avon Outreach Center in Bristol. And also have a passion for septic division or infected division surgery, where we take the infected implant out and we try to put it in essence.